Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Adult Simon's Family Studio. Joined this morning on our studio by a couple of great folks. Of course, Hawkeye to the right, and Dr. Doug Girod, Chancellor at the University of Kansas in Lawrence, or actually the whole University of Kansas, I'm sorry, and former Executive Vice Chancellor here at the Med Center, a very good friend of mine, and a fine fly fisherman, a better stock car driver, but we're not going to talk about that today. Instead, we're going to talk about all things COVID here on the campus. And we're also going to talk with Chris Wilson, who's our VP of System Integration and Innovation. And Chris has been intimately involved trying to work between the Med Center campus and the University of Kansas Health System and the University of Kansas, trying to make sure that the opening is smooth, honest, clear, and transparent. And so we have a great program today to try and talk about all things related to school reopening, especially. Yeah. Dana, hi. In the meantime,
yes.
How are things?
The numbers are still pretty good. Okay. So we want as few patients in the hospital as possible. We've been really now at that mid to low 20 range for the acute sick patients. So 24 today, 9 of those in the ICU and 6 on the ventilator. And I think overall, you know, in the Kansas City area, we understand that the cases, again, based on kansascity.com, which is a compilation of all of the local public health departments which comprise the Kansas City area, the numbers are decreasing. But if you look at those individual counties, or even in the state in Kansas and Missouri, you can see some increases. And that goes to what we've been talking about, the individual infection dynamics in that community, because it is so specific. So if people are looking for one specific answer, it's very difficult to get that overall number. But certainly you can look at trends, and especially looking at those in your own community.
Yeah, really important information. I also need to introduce 2 other special guests on the program with us today. One, Anthony Fauci. We're going to talk more to Anthony in just a little bit, or Dr. Fauci, at least this Dr. Fauci, and the coronavirus. I know this is courtesy of the infection control team who gave this to me here at the University of Kansas Health System. And thank you, Amanda Gartner, because, you know, this has been my daily reminder of cows, COVID weariness syndrome. We're going to spend a little time on those things today, but we're also going to spend a little time, of course, with Dr. Girod. So talk to us a little bit. How are things going so far with reopening at KU?
Well, we started classes on Monday and got off to a solid start. You know, we've done so much work over the course of the summer leading up to this. We spent the spring getting through the spring as we transitioned to remote everything, and really spent the summer getting ready to open campus. And hundreds of people spent literally thousands of hours doing that, going through 250 buildings, 600 classrooms, spacing out for social distancing, putting in PPE protections, redesigning stairways to go up and down to decrease interaction. And our faculty really spent the summer redesigning their courses to be able to meet the students where they are. And so about half of our coursework right now in terms of credit hours is online, and about a third is in a hybrid format, and about 18% of it's face-to-face, and that's largely the small group activities, laboratories, design studios, things like that. And so we've really de-densified campus pretty significantly. But then, you know, a big part of it is trying to figure out how we anticipate the health and safety. So we also have a system checker app that everybody fills out every day, and you scan your way into the buildings. And just to remind everybody to sort of do your own self-check before you start your day out. And then with your help, an extensive testing program on the way in, of testing every faculty, staff, and student as they enter the campus this semester, which has been a huge logistical undertaking, and couldn't have done it without Chris Wilson, who's with us in the studio today, working with our team at Watkins, and Lawrence Memorial Health System has really been a tremendous asset as well.
Yeah, it's been that kind of thing. How do you handle a mass migration of 20,000 plus people into a community of 80,000 and yet maintain control of the spread of the virus, especially amongst young people? And we know that age group between 18 and 30 tends to be more spreaders, if you will, around the coronavirus right now. And so it's really important that we try to do that entry-level testing. So, Chris, talk to us about some of the things that we've been doing to help plan that and our partnership around the community to get that done.
Yeah, sure. So we partnered with the university and the Clinical Reference Lab, or CRL, that I know has been on this program in the past to help design a program for an entry testing effort using saliva, PCR-based saliva testing, and pretty much tested and offered tests to those that would be on campus prior to September 7th. That testing program started towards the beginning of August with the on-campus housing population, and over the course of the next couple weeks and even through today has been testing those that either faculty, staff, or students that would be participating in the on-campus environment at KU. We're up to just under 20,000 results so far from that testing, 220 or so positives out of that effort, a 1.14% positivity rate. That's actually relatively close to where we thought we would be for the campus upon entry. And what we are also identifying are some of the trends in the various populations that are part of that test. The students that were part of that test, Dr. Girod campus team released these numbers yesterday, but they had 216 of those positives and a 1.41 positivity rate for that group. The faculty have only 6 positives, or a 0.15% rate, which I think is pretty phenomenal and really speaks to 2 things. One, that group taking to heart their own infection prevention behaviors and patterns, but also the county and all the work that they've done over the past several months with their mask mandate and other activities, because those individuals largely have been living in the Lawrence community for the last several weeks. So it's been quite a large effort. I know we'll talk more about some of the specific populations that we want to focus on. But just as Dr. Girod mentioned, a huge thank you and recognition to those folks that helped make that happen. Andrew Foster, Sarah Waters, Melissa Smith, several individuals that helped lead that effort. But then also I met retired teachers, current students, former students, a lot of former military members who helped participate in the collection of those samples over the last 2 weeks. Really a fantastic team effort to do something that really hasn't ever been done before, and as far as I know, hasn't otherwise been done in this region.
And we didn't know for sure that we could do it until weeks before, even a week before, when the clinical reference labs got their approval from the FDA to do the salival testing, which was key as opposed to doing that many nasal swabs. And that was a huge win for us to do. Chancellor, do you know of other universities that are trying to do such a mass reentry program like this?
Well, there's really not another one in the immediate region or in the state of Kansas, but there are several that are attempting to undertake this, and it is a really logistical challenge, as Chris just talked about. And the key to this testing is you also have to get your results back fairly quickly, or else they're not very helpful. And so, again, working with the team and with CRL, most of our results are coming back in under 30 hours, and that allows us to do what we set out to do, which was we knew, the virus is out here. It's everywhere. So when you bring in 20,000 people, that some are going to bring some virus with us from the communities in which they lived. And so trying to identify those folks on the front end so we could get them isolated and prevent that initial wave of spread is really what we're after.
Yeah, I remember even back in the 80s, I worked in Oakland, California at the Alameda County Health Clinic for a while as a medical student, did a rotation there. And there were a lot of people coming over from refugee camps that were still left from the Vietnam War and from Southeast Asia. And the first thing you did when you came to the United States is you had to have all sorts of tests done to see if you were safe. And so you didn't bring or spread disease. And I think this is the same concept. You did the community of Lawrence with Lawrence Memorial, who's been, as you've pointed out, a great partner. She's done a great job, so hats off. But if you think about that, it's still a community hospital. You don't want to overwhelm the community resources, either a Watkins or LMH, because you still got to take care of the rest of the community and their baseline health problems and health conditions. And so if you bring a lot of students into a community and they spread the disease amongst that community, it could be a pretty devastating situation. And so what we really wanted to do is limit that spread by testing everyone, identifying those who are positive, and either they go back home or they get put in a quarantine. That's a pretty big undertaking. I just have to say, and obviously we were part of it, but I think the university's done a great job around that. And I know there's a lot of talk out there, and I'm going to sound a little like a homeboy. and I am. But I think you guys get great credit for trying to take on this. I mean, this was really an attempt to keep the campus open, students safe, and the public safe. Otherwise, you would have just let people walk in, and that is not what happened. Instead, you tried to identify those who are positive.
And it is playing out that way in some other areas of the country, unfortunately, and probably predictably. So, as you mentioned, this has never been done before.
Yeah. So we'll see.
We've never lived through a pandemic like this before.
No,
So we, as you've also been saying, every 2 days we're a little smarter than we were.
We are.
And we're learning a lot through this process. I know we'll continue to learn throughout the semester as we continue this and transition from entrance to now trying to maintain as we go through the semester. But, of which you're on, or you chair my pandemic medical advisory team with some of the best
Chris
minds
Wilson
around.
does all the work. Let's be
and Chris
honest.
Wilson does the most of the
He
work.
does all the work.
But really that team, which includes folks from Watkins and Lawrence Memorial and Douglas County Health, really has been on top of this and continues daily to help guide us through this transition. And as we knew we had learned a lot with this opening of testing, and we would see where we had some areas that we had to concentrate some work, some effort, and now we're taking on that work.
Yeah, and even last night we were on a phone call about how do we do athletics safely, how do we open fans, the games and things to fans safely. So it's been a true team effort, and you're right. Dr. Marcelano with with Douglas County as their medical director of the public health department there, and then Jen Scrimsher over at LMH. Two folks have just done great partners. And Hawkeye has been part of that too. So Hawk, can you imagine a better way to have opened a college campus than what we've tried to do?
No, I think it's all been proactive. We understand we can put out the procedures, systems to make it as safe as possible. It does come down to individuals. For the most part, a lot of people are really trying to do the right thing, but we, in partnership with the KU Lawrence campus, have been extremely proactive. Certainly Chris Wilson, as you mentioned, and Dr. Scrimsher, obviously, it's like she has three full-time jobs. Right. Her original full-time job is an ID physician, and then 2 full-time jobs working with the KU Lawrence campus to really set things up as a boots-on-the-ground position there. So it's been really
another
good.
Group is Pavika Sarpali, who's the medical
campus,
director at Watkins, and the whole Watkins team has done a great job at trying to make sure they get this coordinated. I was talking to Dr. Sarpali yesterday. She was mentioning how she's getting phone calls from those who are mad that they're testing and somebody that's positive. I know you're not doing enough because some people are, how can you make it safer? And, there are just some logistical things that it's pretty remarkable we pulled off testing 20,000 people in a short period. Actually, it's more than that because if you count the faculty and staff, what's the total number?
Well, our total that we have results at are just over 20,000 at this point. They come in by the minute, actually, so they continue to come up. As of Monday night, we were at 19,452, and really we expected that we would be somewhere between 1% to 2%, depending on where people were coming from, and unfortunately, actually, a lot of the communities that they're coming from are testing at a much higher rate right now.
I think it's remarkable the students are as low as they are actually.
I agree. We really, when we first started planning this, we were at a different place within our society and more and regionally. But as numbers have started to rise, we expected we might see that with our student population, and we still might. We're still collecting data, but we're really pleased, as you mentioned, Hawkeye. The faculty and staff rate is incredibly low, much lower than the county average. So again, it speaks to how diligent these folks have been about taking care of themselves and each other, and the students are coming in still at a rate lower than we sort of anticipated. But the numbers continue to evolve, and we'll see where it plays out.
Yeah. All right. Well, Jill, I bet there's some questions. Let's first start and see if there are any questions from our media.
Hi, this is Katie with the Kansas City Star.
Hi there.
Hi, I have a couple of questions for Chancellor Girod. Can you talk about the sanctions that could be imposed for students and groups that break the safety protocols that have been laid out? And also, is there a point where you would decide to move all classes online?
Well, the sanctions that can be put in place for students who are not following our guidelines fall under a couple different categories, but the predominant one, though, is the Student Code of Conduct, which we operate the university by, and that code outlines very specific measures that can be taken. But then there's also a county component to that as well. And Douglas County has the ability to leverage sanctions as well, and and has the ability to work both on campus and off campus. So we work very closely in partnership with them. And as we said all along, in terms of when we take it online, and again, we're 48% online right now, so we've really de-densified the campus. But it really comes down to what happens in our community and what's happening within our population, and that's what the Pandemic Medical Advisory Team is helping us look through and understand, and we'll make recommendations of what the appropriate next steps are, which could be everything in between. The reality is the students are here, and whether we're online or not, they're here. And so we need to really remember that as we think about what our measures are going forward.
And I'll just say, Chris, are there groups that you're especially concerned about, or things that we have a watchful eye on?
Yeah, as the university released yesterday, the Greek population in particular has a higher positivity rate than we would have anticipated, and that we're seeing across the rest of campus and really the rest of the community at this point. So they're at a 5.47% positivity rate. So it's really critical that community really engages with the Watkins team, with the public health officials, that understands what isolation and quarantine means, that understands why masking is so important and distancing is so important. That group in particular is one that we want to make sure has the resources they need to be able to be safe and continue to be safe and engage in helping make the campus safer.
Now, I'll just say, too, and I think that such great engagement from your county health department, from Amanda Gardner in infection control, trying to go over and walk through different things and make sure it stayed safe. You know, when you get a larger cluster or a group of people who are positive, that does change the dynamic a little bit, and KDHE could have a role, the county can have a role. It's not just the university, because if you're living off campus, you're really not in a campus facility.
That's really true, and so we have a lot of measures in place for our own student housing. We have about 4,000 students in our various dormitories and scholarship halls, and then there's about another 4,000 students within the Greek community. Only about a quarter of that is actually in a chapter house, and the rest, as you mentioned, is really spread across the community. So it's going to take a team effort to really manage this going through, and we really are going to rely on everybody's cooperation to get us there.
Well, and here's what I'll just say for those, just to help do a little bit of education around this. One of the reasons to do mass testing is to find out the people who are positive before you can become a super spreader and then get it into the entire community of the campus, as well as the Lawrence community. So that's one of the reasons to have gone to such extraordinary measures to get people tested so we could identify it early and not kind of have a false start of the campus. And so I think, again, hopefully that's going to play out.
Well, and the coordination, to your point, Steve, the coordination with the county health department, with Lawrence Memorial Health, and with Watkins, our own health clinic, I mean, having those folks on the same page, literally talking every single morning, to make sure that we know where the numbers are, we know where our problem areas are, and that we have a coordinated effort to address that. It's been just critical so far.
Yeah, it has. Let's see. If there's a reporter, did you have a follow-up question, or if there's another media member who has a question? Okay, Joe.
Hi there.
Oh, please. Well, I heard one. Go ahead.
Yeah. Kat Reed with 41 Action News.
Hi, Kat.
This is a little bit off the topic, but for a story that I'm working on about the kind of pandemic burnout that people are experiencing regarding some of their safety measures, perhaps. I'm curious, it's kind of a two-part question. First of all, at this point, what do we know about the way that COVID is transmitted? Are surfaces still a concern where people should be wiping down groceries and whatnot? And the second part is, are you seeing people kind of taking more risks and becoming more lax because we've been doing this for so long?
You bet. Okay, well, we're talking then, this is about cows, COVID weariness syndrome, and that is real, Dana. So do you think that, talk to us first, how do you prioritize those infection control measures? And then let you and I talk a little bit about, are people more serious or less serious? 'Cause I'm pretty sure the answer to that is both.
Yeah, you know, I have good opinions about that, strong opinions about that. So certainly, first of all, how is the disease spread? The disease is mostly going to be spread by droplets, meaning these small particles that you breathe out into the air, or you laugh, or you cough, or you sneeze out in the air. You can't see them, but we've shown that in the freezers. And most of the time, it's going to be with exposure. And for the most part, exposure is time and times proximity. So how close are you to someone who is infected or who may be infected? As you separate that decreases the amount of exposure. So 3 feet is okay. 6 feet is better than 3 feet, 8 feet is better than 6 feet, and so on. The other part to that is with the droplets, it is very important to use the masks. The masks more as a barrier in case you are sick and don't know it, or if you are sick. The mask will also provide some sort of protection for the wearer as well. So if you can have a mask on for barrier protection, as well as separation by 6 feet or more, you are going to significantly reduce the chance of getting the virus. Are fomites or inanimate objects or surfaces a way to transmit? Absolutely. But we know that when viruses do get into the environment and they are in the droplets and they drop down to those surfaces, they will be spread out in decreasing concentrations. And as they have come out of your body, their concentration will go as well. It is not the major mode of the exchange or transfer of the infection, but it certainly is a possibility, especially if there is somebody who is coughing and you come by a few minutes later and maybe touch a door handle that they were coughing on, and then touch your eyes, your nose, your mouth. So it is a way that it can be spread, but it is certainly not the major way that it is spread. In addition, do I think people are getting weary? I do. I think it's been going on a long time. We know that society wants to get back to life as it was in 2019. But right now, unfortunately, we can't do that, and we have to be vigilant until we get better treatments, until we get vaccination, all of those things. But in addition, I think that all of these measures that we're taking, we're also going to see that on a larger public health scale, and hopefully that starts with the influenza season coming up. So along with vaccination, all of these measures will hopefully also decrease other influenza-like infections, other common cough and cold viruses, but also influenza activity as well.
And I'll just say, I think that that is so true. And I think actually it goes both ways. I think we've seen some people who are taking it more seriously because there's more infections and there's more deaths, and it's gone into a much younger population. As we've demonstrated when Dr. Wild was down here, the percentage or the number of patients we are getting into the hospital who are admitted without underlying health concerns has tripled from COVID-19. So I think there are people who are taking this more seriously. I also think there's people who are just tired. I know we're all tired. We all have little cows going on. I related the story how I was in the woods this last weekend, and for 2 days it felt normal because I was out there by myself. I had a friend of mine. We do the bubble. We're in the bubble, and we didn't have to wear a mask. We were floating down the river. We were camping on the gravel bar. We could fish, and when you do that, you kind of feel normal. Mm-hmm. And you start driving back, you're like, oh, got to get out of the car to get gas, got to get my mask on. And so you're just right back into it. So cows is real. And we have a funny hashtag or moniker for it, but it's real. And I think that what we have to try to do is our best to maintain our mental health in the midst of a pandemic. How about you have that same struggle?
Don't you think there's another element to this, though, is that we all had day jobs, right?
Yeah.
Oh,
Before COVID showed up, before COVID showed up, and then we all took on another day job.
Correct.
And that's true across society, I think, as people, whether it's parents at home now having to try and teach their kids, literally teach their kids because they're not in school, and manage their jobs to the best. I mean, I think this has really had a big impact on our society that maybe is more than just worried about cleaning your groceries or hand washing and mask wearing. It's comprehensive. It
is, and I think that's a topic we probably ought to think about here on our program, because it's going to affect health systems as well as people's. We know it's been estimated that 30% of a workforce may have to leave to go home and handle kids into childcare, and that's a big number if you're in healthcare, right? And so it's going to compromise us all. We all ache and for a return to normalcy, but it's still a little ways down the road. But I think it is coming. I just think it's coming.
And I'd like to make one more point, too. What you talked about with the campus is de-densifying. We understand, and we have said this also, we've been lucky here in the Midwest region, particularly in Kansas City, as opposed to New York, where we don't have that high density. In modeling done with classrooms, what they showed is one of the best measures you can take is more de-densifying and decreasing the density. And that goes to not meeting in large gatherings. Right. So if you can spread out further, not have the dense population, whether that's in a classroom, in a restaurant, in a bar, having that done and de-densifying is going to be a major part to getting back.
Yeah, and some of that data has come out in the last few days and a week or so, so it is really important as you look at that. It really is about not congregating. Yes. I mean, not congregating and wearing a mask. That's the key. The surface stuff is important, but it's how close you are in the mask.
Yeah. And it's, it being on campus the last few days, frankly, it feels more like a summer semester.
There's just not as many
because of that
rooms.
dedensifying, and it really has decreased the flow within the buildings. It's actually gone remarkably well.
Yeah.
And I think for those that are in classrooms, both on the instructor, professor side, as well as the students, there's actually, I think, for many, a sense of relief. And once they now have experienced it and say, okay, this is probably a manageable environment.
Yeah. Chris, thoughts from your end as well about this? And you have young kids, I think.
I do. We have a 10-year-old and a 7-year-old. Our 10-year-old actually has chronic lung, a diagnosis that you know a lot about, Steve. So we take this very seriously in our household, and I live in the Lawrence community, and I'm very pleased to know that there's 220 some positives that the county, that the school, that I know are out there now, that we wouldn't have known if we hadn't have done these types of protocols. And I'd also say that seeing what I've seen on campus so far this week, the dedensifying and the masking and the practices that are in place, I would be very comfortable taking my family on campus and going for a walk and walking around my alma mater. It's something that I really appreciate the bold work and the hard effort that Dr. Girod and his team have undertaken.
Some of those Jayhawks never leave, Wilson.
It's true. It's true. You can't get rid of us.
Go ahead.
Really smart, thoughtful questions from the community today.
Let's go.
I'm going to start with Virginia. She wants to know, could you talk a little bit about the measures that are in place for mandatory COVID education and letting the students, teaching them, hey, here's what's expected?
Yeah, we've had a lot of communication with the students, even starting back in the summer, and as we put together our Protect KU website, and that really it's the central source of all truth, if you will, for what we're doing, both protection as well as training and education, and then have done a lot of targeted outreach as well to various communities. Andrew Foster, who leads our emergency management team, has actually gone and met with a number of communities to talk through what the issues are, and actually to look at their environments too and give advice. And so that's ongoing. It will continue to be ongoing, and as we learn more and we modify, we will need to continue to do that. But that's such a key part. Education is such a key part of this all. And there's still a lot of misconceptions out there, I think, about this disease, and trying to address those uniformly. But we have a policy on campus. If you're on campus, you have masks. Doesn't matter if you're indoors, outdoors, by yourself, or in a crowd. You wear a mask.
Donna wants to know, she's really frustrated about how all the different schools and different entities report the numbers and the frequency. And she's wondering, is there something overall, no matter how you're reporting the numbers, that can be a takeaway? What do they tell us? And can you make them uniform?
Yeah, we can't make them uniform. We don't have that ability. The United States is an interesting place because we do have a lot of individuality and local government rights, and so you can't. Now, it is interesting that at a national level, we went from the CDC to be the reporting agency to HHS, and it just got handed back to CDC last week. So now the CDC is again the reporting agency, and so we've confused ourselves a little bit about the rules and requirements of reporting. I honestly think it worked pretty well by the end when the CDC, it didn't as hard at the beginning, but when CDC had it at the end, they were doing a really good job, and I think that hopefully that'll return. But it's going to be difficult. One of the things we've tried to do with KU is be honest and transparent, Chancellor. I mean, you tell the whole story every day on the numbers, and that's not true of a lot of schools, just to say.
Well, we think that's important. Our community needs to know where we are on this, and we committed to that at the outset, that we would share the data as it comes in, and we will certainly continue to do that. And, and that gets reported also directly to the county. So the county has our numbers as well. They run on 14-day averages, and so there's a little bit of a lag as to how it starts to show up in the county numbers. And of course, they're reporting it to KDHE at the state level. So I believe, at least in the state of Kansas, the county numbers are reported fairly similarly.
I think they are between county and county, that's right.
And that's probably the most reliable, consistent comparison is county to county to county. I think beyond that, to your point, it starts changing.
It does start to change a little bit. Any other thoughts from your standpoint?
Yeah, we've always been transparent from day one here in our health system, and that has just extended to KU as well. And we try to be as transparent as possible. We always say The best places to go for the information is the CDC website, but also KDHE website. Start there, and then you can go out from there. There's also a lot of other people that are reporting. A lot of places are, I mentioned kansascity.com. Obviously, they draw some of their numbers from different places. You just have to figure out exactly who is a good source of truth and use that. But again, start with the CDC and the local health department, KDHE.
Danny, what we're doing at KU with this mass surveillance hasn't been done in the state of Kansas.
Right.
And so it's a little bit also apples to oranges in terms of what the numbers mean. Can you talk about that a little
absolutely.
bit?
And that's a very good point. There was a recent pediatric study that was just published talking about, I think it was 25,000 children that they looked at asymptomatic or just screening for ENT visits. And they found that 1% of children essentially were positive for coronavirus, but they had no symptoms at all. That's similar to what we saw here as well. So we tested a large group of people, and that is what we are trying to do. We want more testing available. As you can test more people, you can drive up the number of tested, and then you can hopefully drive down the number of total positives and drive down the percentage. We don't necessarily have that mass testing that we were able to do at the Lawrence campus. We would like to get that for everybody. That will give us a more true picture of how the disease is spreading in the community at that one point in time. So if we could do that for everybody in the community, whatever community you live in, you would get a much better picture. I think you would also stop the spread because those people that are positive would be isolating for 10 days or more. And then once they're okay to get back into society, they could do that. But as you have more testing, more results, you're able to get just a better picture overall. And that's why I think doing this at the Lawrence campus and that large of a number, and most importantly, as you said, getting the turnaround time, getting those results back quickly within 24 hours has helped a lot to show that if you do this, you can really get a better picture. Now, it is a specific demographic, but you can get a better picture of really what the disease spread in the community is.
It's kind of a different way to think about what you used to always talk about, which is flattening the curve.
It is flattening the curve. And Dr. Fauci still will talk about that on the backside of this, is flattening the curve. That's very important because we still want to flatten the curve, and that's still important in Lawrence.
And that's really what we're trying to do, is flatten the curve of what would happen if we weren't doing this.
Yeah.
I think the disease would continue to spread.
Oh, the disease, if we did
asymptomatic,
I think we'd see
that.
what's happening in some of the other college campuses,
Absolutely.
right? I mean, it was reported yesterday at University of Alabama, 500 new cases, right? And that's a spooky high number. And so I think if that were to continue on a number of days and it continues to grow and spread, that's what's going to lead into a real problem, I think. So.
A lot of people asking, how often are you going to do the testing on campus? And to your point, they want to know, why doesn't Lawrence do the saliva testing and see what the whole community is?
Yeah, so first of all, saliva, it is expensive, though, and there are limits in financial resources. We received Spark money to help do that, Chancellor, and that really helped.
Through the Board of Regents, we had an ask to the governor and her Spark Commission to deal with CARES Act money, so it's federal dollars, and we put together a proposal for that. But the money doesn't help you if you don't have lab capacity. So the key element for us was the connection you were able to provide us with CRL, which is a Lenexa-based company that has developed this test and developed it at fairly high capacity and has allowed us to do this. Otherwise, there was no way we could have.
Chris, talk a little bit about CRL. How many are they up to being able to do a day now?
They can do up to 20,000 results a day at this point. Since we started this program, they've had a lot more reach outs from other universities, large organizations. I believe the Los Angeles School District is on that list. So very large organizations that are trying to find testing capacity, which heretofore hasn't been as available as we would have liked it, and maybe even in particular in this state. What we've seen with the results of this initial entry testing is the positivity rate drop in Douglas County because we've added so many tests to the mix in that denominator of that percentage. So a week ago, you were at 5% or so in Douglas County, and now we're down to 2.6%, I think was what was released on Monday. But just because testing's been such a precious resource, and we haven't had as much of that available to the population. And now if we're able to do more of that, which I certainly advocate for, more availability of testing and more funding and research and development of more efficient testing modalities will certainly serve us all better.
And I think, to be fair, the campus is not a closed ecosystem, but it's sort of a close ecosystem, and that makes it a little bit easier to do a program like this. If you went out to the entire Lawrence community and said, now let's test, who are you testing? How is that going to get? I mean, there are lots of logistical questions. Not that that would be a wrong thing to do, but we also don't even have a way to really run all those tests. And so that's one of the struggles we have. And it's funny because we feel like we don't have enough tests, but the United States has 70% of the world's testing being done. But if we want to control the pandemic, since it's been a little out of control, that's what we'll have to do. And the reason you test is to find the positive. If you find the positive, you can quarantine folks. They don't spread it to the next person.
We've got some people that are asking about back-to-school gatherings. I think it's really pertaining to sporting events because they're talking about 300 and 500 people showing up, and they're curious about how will sporting events and crowds be mitigated.
Well, we're working on that one
We
even
are.
now, aren't we? We met last night about that very question.
A lot of effort's gone into that with a lot of guidance of how big is the space. Outdoors is better than indoors. Masks are better than no masks, clearly. And can you adequately distance as well? There are some concerns. I mean, breathing and yelling are two different things, I think, in terms of potential spread of particles. So, at least at KU, our athletics department has done a lot of modeling and working, trying to run through multiple scenarios. And to be honest, we've not settled on one yet. And we're, again, relying on our pandemic medical team and then ultimately had a conversation with the county to see what that's going to look like. That has not been determined yet for us.
Okay, so to be continued, and we'll have to have you back.
Yeah.
Yeah,
Margaret,
we do have to have him back. But it's an interesting discussion. I do want to give a shout out. Your athletic director, Jeff Long, has just done great. I mean, everybody thinks athletics is about money. It's about money. I'll tell you what, he has said very clearly over and over again, we got to put the kids first, we put our families up there, our families first, our fans first. I keep hearing that from him again and again, and the guy is just great, and I think he's done a great job helping work with us and leading athletics through this pandemic and trying to do the right thing around the kids and around the fans.
And I think that's important with athletics, and it is a big part of that pressure to return to normal, right?
Yeah.
Everybody wants to get it back.
They do.
Everybody wants to figure out how to do it. Obviously, the economics are not insignificant, whether you're professionals or collegiates, but safety's still got to come first.
It really does. And I think, what we're concerned about is if you bring a bunch of fans into a stadium, it only takes a few people to spread a lot if the fans are too close together. If you can really maintain social distancing, you can get a lot more comfortable. And if people are wearing masks and social distancing, you can get a whole lot more comfortable. And if you're outside, you can kind of get there. And I think that's where we are. But I think what we first have to make sure is we have a good sense of where the campus is headed and how the campus is doing before we say, let's go out and have fans in a stadium. So I think that's important.
And for the athletes themselves, obviously making sure they're safe. And so our athletes are getting tested 3 times a week right now. They're twice a week, and then they will get tested the day before competition as well. So we have the most up-to-date data possible as you field a team as to who's healthy out there and who's not. And obviously, if you're positive, you're quarantined, and we do all the contact tracing. But I'll tell you, the athletes, at the beginning, it took some adjustment, but they've done a great job. Chris could probably speak to their testing, but they've really, in recent weeks, have really figured out how to do what they need to do and stay healthy.
Yeah, so talk a little bit about that, Chris, because the KU athletic program has done a great job.
Yeah, they deserve a tremendous amount of credit. So like all of us, when they first re-entered to campus, there was a lot of learning on how to adjust their habits and practices and how to modify how you might conduct a practice or how you might conduct a coaching session or a film session. And for the last several weeks, they've had very minimal positives, if any, in their regular weekly testing program. And I think they deserve quite a bit of credit as stepping up and producing the results that they've had, and they're doing everything they can to make sure that they're able to play this fall. So big shout out to the team there for all the work that they've done to get to this point, including Brian Conway at the very least, who's our senior administrator for sports medicine over at Kansas Team Health. Has done a great job getting those programs in place and working with the various teams to make sure they're as safe as possible.
Yeah, Jeff Randall and Larry McGee have both done a great job of the team docs, and then Sean Lester on the stadium design side spent a lot of time with a lot of experts from here and other places to get that right. So.
Anil, you remember him?
I
One of our
remember Anil
patients.
Garmacher.
He's watching.
I
this
said his
morning.
last name right, too.
You did. You did. He wants to know, with people showing positive for up to 60 days after infection, is there any way to differentiate between asymptomatic or previously infected individuals?
Yeah, that's a great question, Neil. I'm not surprised you asked
Sure
that. So,
question.
what do you think, Dana?
You know, I think it depends on when they were tested. I think it comes down to the individual. You know, did you have symptoms a week or 10 days ago, no matter how menial they were? There was a person I saw in the hospital who had had a slight cough for 24 hours 10 days before he came into the hospital for something different and got tested. So I think that's a very good question. I don't know. I think you have to take that on an individual case. So you don't really know when they were infected. That's a very good question. At this point, we are still using the time of the first test as your quarantine or isolation time. And then from there on, you know, if you go 60 or 90 days, it's really not recommended you get tested again. So that is what we are using. That's a great question, but right now we are just using the time from first test if you do not know or remember that you had symptoms.
Yeah, so Neil, it is a great question because you could have been infected 30 or 60 days ago and still had a positive swab in a salival test. I think that salival tests, especially some of the tests that they can do a two-part test. Now all our nasal swabs do a two-prong test, and that helps a little bit because you got to find more viral particles. But I think that it is a great question, and it is true. You could be positive right now, and you may have had your infection 2 months ago, and we may quarantine you. That is a true statement. But the problem is you don't know what you don't know, and so you do the safe thing. And the safe thing is we're going to quarantine you, or say you can't go back in public if you're positive for 10 days, because we know at the end, after 10 days of having an infection, you're very unlikely to spread it. So we just assume, and it's an assumption, but we assume that when we find a positive test, you should be isolated for 10 days before you go back out into public. And those contacts for 14 days, because that's how long it takes to get the disease, develop it, and then be safe to go back out.
And, you know, we do know that people who are asymptomatic will tend to clear the virus more or clear their viral test, their PCR test, quicker than somebody who did have symptoms, and specifically quicker than somebody who had needed hospitalization or even critical illness. So.
All right. So
we appreciate the guidance on that. So as we developed our program, you know, the people who did not need to test either were not physically going to be on campus before September 7th, or had a positive test within the last 90 days. And so those are the opt-outs, if you will, for testing for us because of the advice you all gave us. So thank you.
So Jill, time for one more question, and then we'll wrap up.
Well, I think I'll go with Annie. She just wants to clarify the numbers that are counted on campus go to Douglas County and not the student's home county.
Correct. They come to Douglas County.
And why?
You're living in Douglas County at that time.
That's where they're living, exactly. And it's so important that it does come to Douglas County. And so there's been some confusion about that because how somebody registers to take the test, if they happen to put their home in Chicago, for example, that it could potentially go there. So we make sure that when we get the results, we share them directly with Douglas County. So it does get reported in Douglas County. That's just really important so that we know what's happening in our community.
And I think that was a great question because we've had that question. Well, if somebody is on the Missouri side and they come to our hospital, where does that get counted? So that's a very
a little different answer then. Yep. All right. So listen, we want to thank Chancellor Girod and Chris Wilson for being on our program today. Chancellor Girod has agreed to appear regularly on our update, and we thank him for that as one way to keep the community, parents, faculty, and staff informed. And again, we know that back to school is such a major issue, and really, this is a microcosm of back to school, whether you're in K through 12 or you're in undergraduate education. The best source for COVID-19 related information is protect.ku.edu. Make sure you go there. It's a great site. Dr. Girod started this meeting with his mask on. He took it off because we're 7 feet apart, and that was why we could do that. But as soon as we're done, the masks go back on. We're back out in public. We have to take care and protect each other.
In our world, we'd still be wearing masks.
I know you would, and that is the right thing to do. So maybe next time we'll just all wear masks when you're here. Final thoughts, Dr. Girod.
Well, first of all, thanks again to the team for all the advice, and Chris Wilson for helping our team get organized, connecting us with CRL so we can do this aggressive approach on the entrance. We believe it's going to make a big difference, but we also know that this is, as usual, a highly fluid environment, and we collectively need to stay on top of it. And it's going to take everybody doing the right thing to make this work for our communities.
All right, Chris Wilson, final thoughts.
Yeah, I'd say, these next couple weeks are really important to the local community there in Lawrence, and would just encourage, in particular, the students to collaborate as much, listen as much to not only your physicians and clinicians at Watkins Health, but also the county health department partners as well. They are all there to try to keep you safe and help you and do the right things to make sure that you not only don't get sick or don't contract COVID, but also so that you have a good experience in your semester here.
All right. Thank you, Dana.
Yeah, I think we all do have a little bit of COWS, COVID weariness syndrome. It's all up to us to do the individual right thing, and even though we're weary, every day is a new day. Continue to understand and do those things that we are endorsing. Don't meet in large groups. Keep your distance from other people and wear masks. Also, hand hygiene, that came up with the question, are surfaces important? I absolutely believe they are, not only for coronavirus, but for other infectious diseases as well. So absolutely, hand hygiene is very important, and avoiding touching your hands to your face, such as in your eyes, your nose, or your mouth.
All right, so tomorrow, are you having trouble sleeping? Well, feeling anxious and stressed? Yes. Want to boost your immune system? Clinical dietitian Tara Marcello has a shopping list to help all three during a pandemic. I wonder if Lay's potato chips and fried chicken are on that list. Tune in tomorrow. Don't say doubtful. Tune in tomorrow. We'll find out. Also, another blood drive to tell you about. This one is on this campus from on Thursday and Friday from 7 a.m. to 7 p.m. We have a couple of cool old people selfies to show you to support folks wearing their masks.
Nice. Special
Thanks to Steve and Wendy. And then Allison proves young people can do it with their, I almost said that really wrong. Allison proves young people can wear masks as well in public. Keep sending those photos to us. Medical News Network at kmc.edu. Okay, a last word of advice, folks. Here we go. Fauci facts right here. When you're wondering what's going on in the world, this is the guy you listen to. And you know what Fauci's going to tell you? He's going to tell you how you beat this guy, because we want to beat coronavirus, right? Get him out of here. Because, as Travis Kelce said, and my daughter corrected me, I understand the Beastie Boys came out with it first, but I watched Star Trek and not the Beastie Boys. You've got to fight for your right to party. So for all of us out there, we want to get together, we want to go in groups, whether you're in the Greek life or you're old like me, you do want to go out and hang out and do stuff. But you got to fight for your right to party. And the way you fight through cows, you listen to this guy, you listen right here. And we'll be back here tomorrow to talk with you about all things Corona again. In the meantime, remember, there's still no place like home.